Physical therapy students and physical therapy graduates. This is Dr. Kamel again, and a new content which would be useful for preparation for license exam if you are planning to um, travel, work, and study in the USA or Canada or Australia, and even for the Gulf area and United Arab Emirates and other countries. They are also running uh, license exam, so this would be useful for you as well. So if you didn't see any of my videos before, please subscribe to my channel. Let me briefly introduce myself. My name is Dr. Kamel. I work as Associate Professor of Physical Therapy in the United States, and I'm a registered licensed physical therapist in the United States, in the UK, and in Egypt as well. So let's go to the content of today and see what is the topic for today is about. The topic or the question is saying a physical therapist is positioning a patient for postural drainage. So when I'm hearing postural drainage, I know this is pulmonary or respiratory content, and this will uh, take my attention to the CVP or cardiovascular and pulmonary, which is a heavy content for some of the students or a little bit complicated for some of the students. Okay. To best drain the posterior segment of both lower lobes, the patient should be placed in which of the following positions? Okay, so we have different positions for bushal drainage, as we will see now in a minute. And for each of the segments of the lung, we would like to position the patient in certain position in which gravity will assist the drainage of this lung segment. So in order to drain the posterior segments of both lower lobes, I should position the patient in prone lying position, head down at 45-degree angle. I should position the patient in supine lying position on a flat surface, so there is no elevation or of the leg or elevation of the head or anything, nothing upside down. Side lying position, head elevated at a 30-degree angle, or sitting and leaning forward, which we are using this position for the upper lobe mainly, and of the some segments of the upper lobe actually. So let's check and understand this question. As you can see, there are different positions for bushal drainage, and each one of them will be used for draining one of the segments of the lung. We might have a semi-forward position, we might have sitting leaning forward, supine lying position, prone lying position, side lying position. We might have elevation for 12 inches, 18 inches. Okay, some people they have a good visual memory, so they would like to memorize these pictures by seeing them, and others they would like to memorize tables. So anyway, we need to know these positions because I'm 100% sure you will get a question on bushal drainage. So bushal drainage is mainly one of the techniques which we are using for airway clearance or the airway clearance techniques. So if we understand the anatomy of the lung, we know that the lung we have two lungs, right lung, left lung. Right lung is composed of upper lobe, middle lobe, and lower lobe. Left lung is composed of upper lobe and lower lobe. Okay? Within the lower lobes, we have different segments. So we have the superior or the apical segment, the anterior basal segment, the posterior basal segment, lateral basal segment, medial basal segment. This is only on the right lung. Okay. So the posterior segments of lower lobes are located towards the back and bottom of the lungs, which is inferior and posterior. Okay, now I understand the briefly the anatomy of the lung. I understand briefly what segments I'm going to drain. But if we talk about bushral drainage itself, it is a technique in which we are using gravity to assist mucus movement from the lung segments toward central airways for clearance by coughing, or if the patient is unable to cough, we can use suctioning. Okay. So to drain the posterior basal segments, the bronchi must be directed upward, meaning the patient head should be lower than the chest. We call this a Trendelenburg position. And the back side of the lung should face upwards. So as you can see, the patient is prone lying, head is down by 45-degree angle. Okay. So this is actually the answer. So the answer is prone lying, head down at a 45-degree angle. So the position of the patient will be lying prone on the stomach with the bed tilted so the head is down about 45 degrees, Trendelenburg position. In this position, we allow the gravity to drain secretions from the posterior basal segments of both lower lobes. Okay, we can do further assistance for mobilization of these secretions and getting rid of these secretions. So the therapist can do percussion, vibration, which are techniques helpful, for clearance of secretion on the lower ribs on both sides of supine. So I will do percussion, and while the patient is exhaling, I will do vibration. Okay. So this is a correct answer, number one. Incorrect answers: supine flat surface. This position is used to drain anterior segments of the upper lobes, not posterior lower lobes. Okay. So gravity here directs mucus anteriorly, not posteriorly. How about side lying, head elevated at 30-degree angle? This position will help upper lobes apical drainage or middle lobe segments. Okay, depending on the side, because you know that there is no middle lobe on the left side. We have only upper lobe and lower lobe. So we elevate the head, not lowering it. This works against draining the lower lobes. So this position will not work for drainage of the lower lobes. Number four, which is incorrect, sitting leaning forward. This will drain the posterior segments of the upper lobes, not the lower lobes. And this is useful for patients with upper lobe secretion, especially patients who have bronchiectasis in upper lobes. So what is the correct answer again? Is to drain the posterior segment of both lower lobes, prone lying with the head down, and lower extremities and hips elevated to about 45 degrees. If you would like to join my course for license exam preparation, please send me a message on these numbers, 001 442 248 7206 or 0020 102 774 3702. I will send you all the details about the course. Um, if you would like to apply and study for the transitional or the post-professional DBT program at the University of Montana at United States, study is online. Please also drop me a message on WhatsApp numbers, and I will send you the required documents, transcripts, everything, because actually the time for closing the application for the next semester will be closing soon by the end of November. Thank you so much for subscribing for the channel and for listening to my videos. And please, if you don't mind, if you can share the channel with your colleagues at university and with your other physical therapists, would be much appreciated. Thank you and see you soon.